COVID-19 infections are on the rise in at least 20 states ahead of Thanksgiving. CBS News' Bradley Blackburn has more.
Some good news for millions of Americans looking forward to the holidays.
If you get vaccinated and your family's vaccinated, you can feel good about enjoying a typical Thanksgiving, Christmas with your family and close friends.
The nation's top infectious disease expert, Dr. Anthony Fauci, says the U.S. is still seeing about 70,000 new COVID-19 cases a day. While that's down significantly from mid-September, some areas are now seeing an uptick.
We still have about 60 million people in the country who are eligible to be vaccinated who have not yet gotten vaccinated.
Some hotspots in the country, like Colorado, are taking additional steps to get a handle on infections. Starting Friday, the state health department will require proof of vaccination at most indoor events with more than 500 people. Officials in Colorado have also made booster shots available to all adults, not just those in high-risk groups.
Everybody should get the booster after 6 months. The data is incredibly clear that it increases your personal protection level.
Dr. Fauci said if most people who are eligible for a booster go get one, 2022 can start looking a lot more normal. But there are many miles to go before we turn the page on 2021. Dozens of Democratic lawmakers sent President Biden a letter asking him to require proof of full vaccination or a negative test for airline passengers on domestic flights, hoping to reduce the chances of another winter surge. Republicans in Florida are taking a different approach.
We believe that people should have options.
State lawmakers are considering legislation to block federal vaccine rules and limit mask mandates. Bradley Blackburn, CBS News, New York.
For more, I want to bring in Dr. Robert Frank. He's the director of the Vaccine Research Center at Cincinnati Children's Hospital. Dr. Frank, welcome. Thanks very much for being with us. Cincinnati Children's Hospital is conducting COVID-19 vaccine clinical trials. What can you tell us about these tests?
Well, we've been doing clinical trials here at Cincinnati Children's for about a year and a half now, and that we started with the phase 1 trial in adults and have marched down in age from the adolescents then to the 5 to 11-year-olds, and now we're actually, today I enrolled an 8-month-old.
An 8-month-old, that's pretty remarkable. How has the pediatric vaccine rollout actually been in your hospital, and how do public health officials keep this momentum going?
Well, so about a week ago, as we had our first vaccine for the clinic for 5 to 11-year-olds, and they asked if I would come by because people knew that I was associated with the trials. And I went over and I thought maybe there'd be about 20 or 30 people. There were 350 children that we vaccinated that night. And it was really amazing. The kids were excited. They were happy. They all had masks on, parents all wearing masks. They're all calm. They waited in line. I grew up in Southern California. It reminded me of a line at Disneyland waiting for Space Mountain, but that everybody was really excited. It was really kind of almost like a party atmosphere.
That's really interesting to hear, because you wonder how it is that, this is explained to children, but clearly, for a lot of parents, there are very strong feelings about getting their children vaccinated just as soon as they can. Meantime, Colorado, California, New Mexico, and now New York City have expanded booster eligibility to all adults. Doctor, why aren't more cities and states doing the same?
Well, I think what we were looking at is getting availability of more and more vaccines. So this time last year, no one had a vaccine. And so it was just about January of 2021 when we started getting vaccines. So at first we were rationing vaccines a little bit to make sure we had enough for the people that really needed it. And that's kind of the rationale looking at for the boosters right now. If you look at it, Elaine, is that it was at the end of August, so data's a little bit old, but still pretty recent. 97.5 of the COVID-related hospitalization were in unvaccinated people, and 99% of the COVID-related deaths were in unvaccinated people. So really that's where it's not that the boosters are problematic, they're not going to hurt you, but what we really need to do is make sure that we have as many of people as we can get that primary vaccine series, because that's what we really, really need.
Well, the Washington Post reports several rural states with few mask mandates and low vaccine rates are actually seeing a high percentage of residents getting boosters. What might be contributing to this?
So I think a lot, unfortunately to me, too much politics has gotten into this. This is a public health emergency, and that the virus doesn't care your background, your age, your race, your gender. It doesn't care. It just wants to infect anybody it can. And what we want to do as in medicine is to keep you safe. And that's why over 95% of doctors and healthcare people in the United States have been vaccinated against COVID.
Well, finally, Doctor, Thanksgiving, of course, is next week. What advice do you have for people looking to safely celebrate with friends and family, especially given, as you point out, this really difficult political terrain and the way in which this has become a really highly charged issue for many, many people in this country?
So what I would advise is that anyone who can get vaccinated, please go get vaccinated. That now anyone 5 years of age and above can get vaccinated. The vaccines that have a very good safety profile, they're very effective. And by having as many people vaccinated as possible, I think we can really prevent from what happened last year when people did travel and understandably want to go see their families. We don't want to have another peak like we had last year. So please go get vaccinated.
Dr. Robert Frank, Doctor, thank you very much. We really appreciate it.
You're welcome.